Good morning. I am NyKera Fooks for the Power of Patient Project. Today we are joined by Emily Davis. Emily is the Marketing Manager for Hospice Services for Bayada Home Health Care, headquartered in Pennsauken, New Jersey. Emily is a recognized patient advocate with an MBA from Holy Family University, where her focus was in healthcare administration and a bachelor's degree in social work from Temple University. She's an accomplished administrator, having worked in elder care for many years. So, welcome, Emily. Thanks for joining me today.
Good morning, NyKera. Thank you so much for having me. It's such a pleasure to be on the patient project for a second time around, but in a new healthcare role as well. So I'm so excited to talk about hospice care today and share a little bit about what I do.
Okay, Emily, so let's begin. What is the definition of hospice?
So talking about hospice care is a form of palliative care, and hospice care provides comprehensive comfort care to patients that typically have a serious or terminal illness. They are choosing not to receive curative treatment. Hospice care is the most care a person can receive towards the end of their life, and it's completely covered by Medicare. The ultimate goal of hospice is to provide quality of life for a person while managing their pain, their symptoms, providing comfort, as well as supporting their family and their support system too.
Okay, so I've heard before that there were several options for hospice. Can you share a little bit with the audience what some of those might be?
Absolutely. So there are 4 types of hospice care. There is routine home care, which is the most common, continuous home care, general inpatient care, as well as respite care. So to give a little background of each one, routine hospice care, it's the most basic level of hospice care provided typically in the home or wherever you may call your home, so an assisted living or a nursing home. It's the level of care that offers a team approach. So that usually includes your social workers, your nurses, your nursing aides, as well as a physician to follow to provide comfort towards the end of your life. And this hospice level of care, it includes a variety of a team approach, like I said, also bereavement counseling for the family. There's also medical equipment, medication, services, and supplies that are provided by the hospice organization for the patient at the time. The next one, continuous home care. This is the level of hospice care when a nurse stays in the patient's home for an extended period of time. So when a loved one is experiencing a medical crisis or severe symptoms that are needing additional support, this is typically when continuous home hospice care is provided. Next, general inpatient care. So a lot of the times general inpatient care is provided at a hospital or a facility that can provide that short stay of time in an inpatient facility. So if a loved one's needs are typically more intense and may not be able to be managed in the home, they may choose for general inpatient care of hospice. And last, there is respite care. So respite care is the level of hospice care that is provided on the occasional basis. It offers a short-term break for family members that are receiving hospice care, that their loved one can go to a facility. The family may take a break, whether it's for their own physical health or their needs or their mental health. And it's typically held in a facility, a hospital, or a skilled nursing facility, and they have that 24-hour care provided there. And those are the 4 types of hospice care. Those are typically determined by a physician or a specialist. And like I said, most patients, when they are receiving hospice care, they are getting that routine home hospice care.
Okay, do you feel as though there's a certain stage that a person might need to be in for their family to figure out if they should be in hospice?
Absolutely. So, as you guys may know, hospice really has a negative stigma towards it just because in American culture, we're so fearful of approaching the end of our life. So ultimately, my goal and the goal of others is to have these conversations as early as possible. That way, we're becoming more comfortable with what are our needs, what are our goals, and what can be offered at that time. So, when a patient is considered for hospice, they typically need a prognosis or diagnosis of 6 months or less of living. That's not to say that that person will outlive those 6 months. It's very common that earlier a patient is referred to hospice, the longer they will be on hospice care. We usually see people that are declining in their care. A very big indicator to know when hospice is appropriate is when someone wants to completely avoid going to the hospital. They want to receive their care at home. They want to stay at the comfort of their own home, and they don't want to be going in and out of a hospital to receive that care. Also, they will need that additional support in the home. We see a lot of patients that may have a later stage cancer diagnosis, but they don't want to continue on with curative treatment. Hospice care is a great option for them. We see a lot of people with end stage of congestive heart failure, as well as when you picture a patient that might be eligible for hospice, you might think of someone who's sitting at home and they have all of the things that they need surrounded around them, whether it's their water, their food, their equipment, because when they get up and they have to walk across the room to go to the refrigerator, they may be out of breath. Usually that's when we determine, okay, let's talk about your care options. Maybe hospice would be a great plan for you.
Okay, so I was just telling someone a little bit earlier that I had a grandmother that was in hospice, so I understand, a little bit of the process. And my one main question always used to be is, what if somehow the patient progresses? Would the family decide then to take them out of hospice?
Yes, so it is very possible. We have a team that continues to evaluate to see if a person is eligible for hospice. So if they are continuing to get better, they are increasing their activities, their pain is decreasing, you see a change and they're improving, they can graduate off of hospice and they can most certainly come back to hospice care if need be. When they graduate off of hospice, maybe they look into a little less intense form of care, such as home care, but it is very possible for someone to be on hospice, then graduate off, and then eventually possibly go back onto hospice as well.
Would it be the same process to get them into the hospice as it was the first time if they graduated from it?
Typically, there's a variety of different ways someone goes into hospice care. Unfortunately, most of the time is when we see someone who has some type of traumatic event and hospitalization. Unfortunately, because people want to avoid hospice so frequently because of that negative stigma, they wait until the last possible minute to start receiving hospice care services. But if someone is interested, they think they might be eligible, they have a loved one that's declining, that they need additional support in the home, they are more than welcome to call a hospice organization. Like you said, I work for Bayada. They can call, we can send a nurse out, and we can evaluate to make sure that they are or they are not eligible for hospice care.
Okay, so finally, when the family does feel like they need to reach out to you guys, you said that they can give you guys a call or anything like that. So, if you can explain a little bit what exactly the process is, you said a nurse comes out and does an evaluation. So, what goes after that point?
Sure. So when someone is ready for hospice care, like we said, we want to try and avoid waiting to the last minute when there's a hospitalization or an emergency. So when someone is referred to hospice or a family reaches out to a hospice organization, they will typically send a nurse out to do an evaluation, go over what your goals are for care, what your needs are, what does your support system look like? And once the eligibility is determined, you'll have visits between nursing aides, nurses, social workers. Some organizations offer music therapy or pet therapy or bereavement counseling. So it's really a multidisciplinary approach to care that's very individualized according to each person. So we want to make sure that we are meeting the needs of each individual and it's not just a standard across the board. Everything is determined about what your needs are and what your family's needs are as well.
Okay, so just to backtrack a little, I did hear you mention, you were saying if there was an emergency. So is there ever a point where hospice can't do anything and the patient has to go to the hospital?
Again, it's really according to the goals and the needs of every individual. So when people are older, they may want to avoid the hospital. They may choose that they don't want aggressive care to continue a longer life. They are focusing on the quality of their life rather than the quantity. So it's again very individualized. We a lot of times we have patients that may be in their 90s, very older, but yet they still want to go to the hospital and receive that care that a hospital would be able to provide. And it's really just what your preference is. A lot of the times people would like to focus on, I want to be at home. I want to be with my family. I want to be comfortable and I want to manage my pain in the comfort of my own home. That's when hospice care would come into play.
Wow, okay. Thank you so much. That was informative. Like I said, I had relatives that were there and I never fully understood the whole concept. I knew it was just a place for them to feel comfortable, to finish their life. But I just never got what the basis of it was. So thank you for informing us today. So that's all the time we have. Thank you so much, Emily, for joining me today. I am NyKera Fooks for the Power of Patient Project, the National Library of Patient Rights and Advocacy. Thanks for joining us.
Thank you very much.